Peptic ulcers are sores that develop in the lining of the stomach or the first part of the small intestine, duodenum. They are usually caused by a bacterial infection with Helicobacter pylori, H. pylori, or by the use of nonsteroidal anti-inflammatory drugs, NSAIDs, such as aspirin, ibuprofen, or naproxen. The treatment of peptic ulcers depends on the cause and the severity of the condition. The main goals of treatment are to heal the ulcer, prevent complications, and prevent recurrence. The choice of regimen depends on factors such as local resistance patterns, drug availability, and previous antibiotic exposure. We discuss types of regimens, each with different combinations of drugs and durations. The most common regimen is triple therapy, which consists of a proton pump inhibitor, PPI, clarithromycin, and amoxicillin or metronidazole. However, this regimen may not be effective in areas with high clarithromycin resistance or in patients who have used macrolides before. Other regimens include non-bismuth quadruple therapy, bismuth-based therapy, levofloxacin-containing therapy, concomitant bismuth and levofloxacin-containing therapy, and second-line or rescue therapy. The text also provides some examples of prepackaged versions of these regimens. A possible concise summary of all regimens therapy of peptic ulcer and H. pylori is: triple therapy, PPI plus clarithromycin plus amoxicillin or metronidazole, 14 days. Non-bismuth quadruple therapy, PPI plus clarithromycin plus amoxicillin plus metronidazole, 10 to 14 days. Bismuth-based therapy, PPI plus bismuth plus tetracycline plus metronidazole, 10 to 14 days. Levofloxacin-containing therapy, PPI plus levofloxacin plus amoxicillin or clarithromycin, 10 to 14 days. Concomitant bismuth and levofloxacin containing therapy, PPI plus bismuth plus levofloxacin plus amoxicillin, 10 days. Second line or rescue therapy, PPI plus rifabutin plus amoxicillin, 10 to 14 days, or PPI plus bismuth plus nitrofurantoin plus minocycline, 10 days. Combination therapies are designed to simplify the treatment process and improve patient compliance. For example, Prevpac is a combination therapy that contains a proton pump inhibitor, PPI, clarithromycin, and amoxicillin in a single pack. Another example is Pylori, which contains bismuth subcitrate potassium, metronidazole, and tetracycline hydrochloride in a single capsule. However, not all regimens have a combination therapy available, and the choice of therapy depends on factors such as local resistance patterns, drug availability, and previous antibiotic exposure. It is important to consult a healthcare provider before starting any treatment.